Tonight, concerns continue to grow about the deadly coronavirus. There are now 260 cases in 23 states.
More than a dozen people have died here in the U.S. Just a short time ago, President Donald Trump arrived at the Atlanta headquarters of the CDC for an update. You can see the latest headlines running at the bottom of your screen.
Now, back here at home, the University of Rhode Island has suspended all international travel effective this Monday until May 1st.
In the meantime, St. Ray's has announced it's voluntarily withdrawing from the girls' basketball tournament against Barrington High School and the Division II quarterfinal boys ice hockey game against South Kingstown. Both were scheduled for this weekend.
Health officials in Massachusetts say the number of presumptive cases of the virus is on the rise. That number is now up to 7. Earlier today, President Trump signed an emergency spending bill to respond to the outbreak here.
Eyewitness News reporter Brittany Schaefer is live in Providence with how that federal funding will be used here in Rhode Island. Brittany?
Well, Shannon, Caroline, Rhode Island has $5 million coming from the emergency spending package. Now, Governor Gina Raimondo says that money will be put to use in many ways immediately. Governor Gina Raimondo commends the quick assembly of the federal emergency spending package, but questions if $5 million will be enough for Rhode Island to combat the virus.
We'll have to see if $5 million is enough. Right now, we need money for equipment, we need money for extra staff, but it's an excellent beginning, and I'm very pleased they moved fast.
Raimondo tells me the state's 3 biggest needs right now are additional protective equipment for healthcare providers like masks, goggles, and suits, extra staff of doctors and nurses to fill the 24-hour hotline, and more testing kits. Raimondo says she's talked to Vice President Mike Pence 3 times this week to demand help.
Every day we have to prepare is incredibly beneficial. And because what you're seeing in Italy and other countries is they got too overwhelmed too quickly. And so what we're doing now, what Rhode Islanders should know, is we're putting in place a really robust response in case we get to a place where we're starting to have to test 100, 200 people a day. I hope we never get there, but we want to be ready if we are. So this money's incredibly important because we need this equipment and we need it now.
And the Department of Health here will be in charge of deciding exactly where that funding goes. New at 6, what message senators want Rhode Island residents to hear. For now, live in Providence, Brittany Schaefer, Eyewitness News.
Eyewitness News reporter Brittany Schaefer talked to the governor and members of the congressional delegation about the funding. She continues our coverage now live from the Department of Health. Brittany?
Well, Shannon, Caroline, the Department of Health here will be deciding where the $5 million will be spent. Meanwhile, Governor Gina Raimondo says medical protective gear and testing kits are top priorities. As hundreds of Rhode Island residents self-quarantine due to the coronavirus, lawmakers say they're bringing back some much-needed funding.
We'll have to see if $5 million is enough. Right now, we need money for equipment, we need money for extra staff, but it's an excellent beginning, and I'm very pleased they moved fast.
It's an important first step, and hopefully it'll give us the momentum to deal with the virus effectively.
Senator Jack Reed says the coronavirus isn't just impacting human health, and more action will need to follow.
For example, when you close schools, you have to ask yourself, in many cases, how are some children going to be able to have a breakfast and a lunch? So we're beginning to think through the second and third order effects, and that will probably require additional efforts on the part of Congress.
More than a dozen people have died from the virus in the United States, and there are more than 225 confirmed cases. State officials tell me while this is serious, there is no time to panic.
People are afraid, so rather than being afraid, let's do something about it to keep everybody safe.
This is serious, and they should treat it seriously, but common sense is the best solution.
And Raimondo says simply washing your hands and calling your doctor before heading to the emergency room is key to stopping this virus. Live in Providence, Brittany Schaefer, Eyewitness News.